Today, let's quickly go through platelet count monitoring in pregnancy, a very important topic for both anesthesiologist and obstetric critical care. So, let's begin with the gestational thrombocytopenia. When we do an initial platelet assessment at the time of diagnosis, if the platelets are stable and above 1 lakh, that's 1 lakh per microliter, we check weekly. But if the platelet count drops below that or delivery is nearing, we check every second or a third day. Also, we check before cesarean section, especially if you're planning regional anesthesia. Now, why is that important? Because gestational thrombocytopenia is generally a benign problem when the platelet counts are above 1 lakh. And as per ACOG 2020, these patients usually don't need any intervention. Now, coming to eclampsia, a much more aggressive condition. Here we monitor immediately on admission and then 24 hours, mainly due to the risk of HELP syndrome and DIC. Before cesarean section, we need to check platelet levels to guide anesthesia, whether to go for a general anesthesia or a regional anesthesia. And postpartum, continue monitoring every 24 hours for at least 72 hours until the platelet counts are stable. Now, this comes from again American College of Obstetrics and Gynecologists 2021 guidelines, which emphasizes frequent monitoring to avoid hemorrhagic complications. Finally, let's look at the anesthesia for cesarean sections across all conditions. Most literature, like Gordon et al. 2019, shows that regional anesthesia is safe if the platelet count is more than 75,000. But below 75,000, the risk of epidural hematoma increases. If you are planning regional anesthesia, it is considered safe if the platelets are above 75 to 80,000. Although there are some guidelines who prefer above a lakh for safety. If the platelet counts are less than 75,000, we usually prefer general anesthesia to avoid bleeding risk. Also remember, if the thrombocytopenia is present, get a pre-operative platelet count within 6 hours of surgery. Thank you so much and wish you all the very best. All this is available on www.barcdrazam.com. Thank you so much. Happy learning. Best wishes.